So this discussion is about the health belief model. And the health belief model, as we're going to discuss in just a few seconds, is largely based on our perceptions, and perceptions on a lot of different dimensions and aspects. First off, I want you to watch this video, and as you watch this video, I want you to pay attention to a couple of things that are said about HIV. One of them that's really important is perceptions of severity. So how severe or serious did the woman that's being interviewed perceive HIV was? Also, how susceptible did she think she was?
Young People Who Rock. It's our weekly series where we feature a different young person or people under 30 doing amazing things. Our young person who rocks this week is 24-year-old Marvelyn Brown, an HIV and AIDS activist and educator, and also the author of The Naked Truth, Young, Beautiful, and HIV Positive. And Marvelyn, HIV in your book is in parentheses, and we'll get to that in a second because you want to keep it positive. But let's just get the elephant out of the room here. How did you get HIV?
I contracted HIV through a former boyfriend who I trusted and loved. It came one night. He told me he didn't have a condom, and at the time, the worst thing I thought that could happen from that was pregnancy.
But that wasn't the worst thing.
Oh, no, absolutely.
How did you find out? You were 19 years old at the time. You were a track star. You were athletic. What was your first reaction when you found out it was HIV?
I was shocked. And I wasn't shocked because I contracted, HIV, which I consider to be this deadly illness, and there was no cure for it. I was shocked that I contracted a virus that I felt I was immune from.
And your parents also probably had the same type of reaction. They didn't know what to do with the surfaces in their home, decontaminating everything. I mean, they kind of went overboard in reacting and dealing with you and HIV.
No one in my family knew about HIV. No one gave me any extra information because it wasn't something that we had seen every day. I didn't know anyone personally living with HIV, and they just didn't know how to treat the situation.
Okay, Marvelyn, we put your story on our website. We got a lot of comments, a lot of questions, and I want to read one to you from John, who says this: How long did it take for you to see the positive side of things after realizing you were positive? So how long was it from when the time you were diagnosed until now, 6 years later?
It was 4 months into my diagnosis because when I was newly diagnosed, just experiencing that at home, and I even had a situation in church where I felt like this was a punishment from God, and this was something that I deserved.
You were sleeping in your car.
I was homeless, and so every day I wanted to die. I thought about death, and I had really just given up on myself and life until I had a near death car experience, and it really and truly
had nothing to do with HIV, nothing to do with these pills you were about to. Show me these pills that you take. This is just one dose.
That's one dose I take every night before I go to sleep. They're my best friends. That's just it. But if I get a cold, or I'm just not feeling good, then I gotta add to it, the Tylenol and different things like that. So I mean, that's just the minimum. It's definitely grown more.
Right, and they have nasty side effects. I mean, everybody should know this isn't glamorous here.
No, not at all. Marketing's glamorous. That's not.
Okay. Well, after 30 years, I'm curious that the disease really gained a lot of awareness. Do you think people's perceptions have changed? Do you think the stereotype still exists?
The thing about HIV is I think people are aware of it. They heard of it, they know of it. They're just not educated about it. And I had the opportunity to look at some of the comments that people were making, and just by looking at the comments, you could tell people had a misconception of HIV as a whole.
And what is that? What's the misconception?
It's a certain group of people. I know tomorrow is Black AIDS Day, which is perfectly fine because it does affect the Black community. But this is a human disease, one that affects us all. And when I tell you I was shocked because I contracted a virus that I thought I was immune from, I automatically put it on gay men, IV drug users, prostitutes. I never thought someone like myself whoever that was could contract HIV. And when I go and I speak, that's the main thing that I hear. And people are constantly telling me I make HIV real to them.
Okay, and here's speaks to Nikki's question right now from your point of view. What do you think is the most effective way to teach young women about HIV?
Okay, so I hope that you got a couple of things out of that. One of them being that, and she even said specifically that I didn't perceive that I was susceptible. I didn't think that I could get HIV. I put it on HIV, IV drug users, prostitutes, gay men, anybody but me. So her perceptions of her susceptibility were very low. Also, she recognized that she didn't have a whole lot of awareness about HIV, about how serious it was. So that kind of leads into this discussion that we're going to have about the health belief model, which really started in the 1950s. A fellow named Hochbaum, Jeffrey Hochbaum, was contracted by the Public Health Service to study reasons for low participation in tuberculosis screenings. And so, as you know, if you're being to be identified as positive for tuberculosis, you would have a positive skin test and a chest x-ray. Oftentimes those are provided in kind of free community clinic settings or outreach events. And despite the low cost or free offerings, participation was really low, and so the U.S. Public Health Service wanted to find out why was participation so low. And so out of that, we have the health belief model, which really is one of the first models or theories that's specific to public health. So the constructs aren't borrowed from other disciplines, psychology or whatever. It really grew out of public health. So the first construct of the health belief model is perceived susceptibility. Now this is your belief about how likely it is that you would contract a particular behavior as a result of your behavior. Now, you start to think about what might influence your perceptions of your susceptibility. Now, talk about smoking, for example. And obviously, you're not going to be able to answer these questions, but think about them. How many people do you personally know that have died from an illness directly attributable to smoking? Now, if the entire class were together and responding to this, if history repeats itself, as I've tried this many, many times in different classes, there would be a maximum of one of you that would know someone who has died from smoking. Now, does that influence your perceptions of your susceptibility? Well, you're probably not smokers. But if it were another behavior and another outcome, would it? Talk about maybe driving without wearing a seatbelt. Perceptions of susceptibility of dying from a car accident because you don't have your seatbelt on. Most adolescents and drunk driving or impaired driving, texting and driving, things like that. They don't know very many people, despite what people consistently say is a very severe outcome. We don't know very many people that's actually happened to, therefore our perceptions of our susceptibility are very low, and so we perceive that it's not very likely to happen to us. So we oftentimes engage in the risk behavior. Same question here. And this one might be extrapolated to other settings. So consider most adolescents. In your opinion, how likely do they feel it is that something bad will happen if they're sexually active? Now, Marvelyn Brown, in the video that you just saw, addressed that. And she said, I didn't think that it was very likely. I was the furthest thing from my mind. I thought the worst thing that could happen to me is that I could get pregnant. So if her opinion is reflective of other adolescents who might be engaging in sexual activity, perceptions of susceptibility for contracting HIV or other illnesses is very low. Brief little video about susceptibility.
In a perfect world, you and I would be having this conversation face to face. I'd be looking in your eyes, and you'd be able to tell just how much I want you to hear the truth. The truth that I never heard as a teenager. I guess I could let you find out the way I did that people lie about sex. But the price for that is really high. So this is my story. I'm going to tell you the most embarrassing thing in my life because I really want you to believe sex has consequences. I'm willing to be your visual aid. The biggest lie that I ever believed about sex was, it won't happen to me. I started having sex when I was 15. I was in love with a guy that I saw every day for 3 years. Just like you, I knew sex makes babies. But getting pregnant was something that happened to other people. It wasn't going to happen to me. We promised each other that we would be together forever. And I wanted him to know how important he was to me. So I gave him my virginity. And nothing bad happened. Sometimes when we had sex, we used protection. But there were times when we had sex and we just didn't. And even though I was really nervous until I got my period each month, I still believed that nothing bad was going to happen. And I kept right on believing that until I missed my period. I was so scared. When the test came up positive, I ran to this boy. The boy that had been telling me every day for 3 years that he loved me. And I said, babe, I'm pregnant. And he said, gee, that's too bad for you. You better take care of that. And then he was gone.
Okay, so perceptions of susceptibility, again, just another example of one's perception that, in this case, she was not likely to get pregnant. Okay, so the next construct is perceived severity. Now, this is belief of a person in the extent of harm or how serious that can result from the acquired disease or harmful state as a result of engaging in a particular behavior. So, how serious or life-threatening do you think influenza is? And again, obviously you aren't able to respond to these, but think about in your own mind, what are your own perceptions? If you're like most people, you would probably say it's